It's another Friday afternoon, and staff at the Texas Medical Center are gearing up for a hectic night ahead.
That's right. We had a guy who had a part of a house fall on his leg, and we did an amputation on his leg just about an hour ago. And we've had 3 seriously injured patients come in the last 20 minutes or so.
Flight Flight 6, Heavy landing south.
Control, Flight Flight 6 landing at fuel. Flight Flight 6, Med Center, northbound. Jet 313, roger, make short approach.
This is the largest medical complex in the world. A virtual satellite city near downtown Houston. But 1 in 3 Texans don't have any kind of health insurance. The only way they can make it in here is if they're sick enough to be sent to emergency.
I enjoy trauma because when the patients come in, I don't require the insurance status. It's irrelevant. And so it's one of the segments of the healthcare system where we have open access to everybody.
$47 million Americans can't afford insurance. And as the economy gets worse, that number's expected to rise. Even if you are insured, it still may not get you into any of the 11 hospitals at the Texas Medical Center. That's what happened to the Kelly family.
You have no idea when you go to the hospital what you're looking at, what their charges are. And plus, our insurance is so expensive, we couldn't afford it.
Three years ago, Lisa Kelly and her husband Sam were looking forward to a comfortable retirement.
See how pretty the pond is?
Like many Americans, they had basic health insurance.
Pretty pond out here.
Then the bottom fell out of their world. Lisa was diagnosed with leukemia.
I don't know what it is. Okay, we'll go.
The very first day is the most emotional.
Glad you're here.
You're just kind of in a daze. It's just, you're in shock. You have no idea.
After Lisa Kelly's diagnosis, doctors told her that this was the place she needed to come to for treatment, the MD Anderson Cancer Center in Houston, about an hour-and-a-half's drive from her home. But even before the first appointment, it became clear that the family was facing not just a medical crisis, but a financial one.
I called, made an appointment, gave them my insurance information. They called me back, I'm sorry, you're going to have the money for us to make you an appointment.
How much money?
I had to, the very first day, I had to go up there with a check for $45,000 before they would give me an appointment.
They managed to pay it, but it didn't stop there.
I mean, even the doctor came out and said, this could cost you anywhere from $250,000 to $500,000 to get your wife well. I said, okay, you know, I would give up everything I got to keep her.
On one occasion, as Lisa Kelly waited with a drip in her arm in the middle of chemotherapy treatment, staff said the appointment would only continue if her husband went and made yet another payment.
My machine was beeping because it was empty and I needed another bag. And she said, one of you are going to have to go down to the business office before we can take you to the back and rehook you. It was one of those rough days.
Yeah, one of them rough days.
What kept you going on the days when it was really difficult?
Just to keep her going.
Just to help her get through it and get better?
Good morning. My name is Holly Wallach. I'm from Administrative Solutions Plus, and I'd like to speak to you about the account of Lisa Kelly, account 69.
As they faced the prospect of having to sell their home to pay medical bills, Lisa Kelly heard about someone she hoped could help, billing advocate Holly Wallach.
Her total self-pay charges come to 143,000.
Holly Wallach lives and works in Florida, spending her days contacting the billing departments of hospitals across the nation, trying to get a fair deal for her clients.
Then who is authorized, and I would love to have their name and number.
Now, Lisa was underinsured. Was she being irresponsible?
No, I don't believe that she was not responsible. I think that she was underinsured, and I think that there are a number of companies that are selling this type of insurance, and 25 million Americans have it, and none of these 25 million people realize that they're underinsured, and the only way they'll realize it is, God forbid, if they get ill.
Management of the MD Anderson Cancer Center refused our request for an interview. But the hospital's policy of upfront payment is not unusual, as US hospitals face growing bad debt from the massive number of uninsured patients. The cost, complexity and failures of its health system have grown over time to become America's most profound domestic policy problem. Hillary Clinton, for one, tried to change the system back in the 1990s.
Nothing is more important to our nation than ensuring that every American has comprehensive health care benefits that can never be taken away.
Her plan was killed off by the powerful interest groups, including insurance and drug companies.
The opponents of health care will always use words like government takeover, rationing, socialization, communism, you name it. They use terms of art that have no relevance to the current debate. They try to scare people. They know that in the past, fear has beaten hope.
Chris Jennings was the healthcare guy in the Clinton White House and is now advising the new administration.
Oh, I can tell you, when President Clinton and Hillary Clinton would travel around the world, the one question they could never answer, all the foreign dignitaries, was how can you be a great and the economic power that you are and you say you are and leave so many people behind?
He's heard all the arguments against change, but says this time it's different.
Everyone sees that the current system is absolutely unsustainable.
There's a cost that now causes a bankruptcy in America every 30 seconds. By the end of the year, it could cause 1.5 million Americans to lose their homes. In the last 8 years, premiums have grown 4 times faster than wages.
His commitment is to develop a system that does cover every single American. It will include specific financial support for people to be able to afford health care through tax credits and direct financial assistance, both through the private sector and the public sector.
Unlike Hillary Clinton, President Obama is managing to keep the insurance companies on side with the promise of increased market share.
We have a crisis, and that's the only time this country does big things. We have an economic crisis. It's linked to health care. And when we have these type of environments, people look towards the federal government to do and take more of a leadership role.
I watched the election coverage, and I was so into it. He knows what it is to not have that insurance and to need the help, and no one will help you.